Video is going to cover crushing a medication with the RX Crush that is one of our hazardous medications. So we need to take extra precautions when we're crushing that. So this is how that video differs from the other video that's loaded onto Elsevier. So when we're crushing a hazardous medicine, Elkhart General has a crush cart that we're going to use. That crush cart has the RX Crush and then all the supplies you'll need in there. So take my little crush cart into the room. I'm going to put my chucks pad down, my plastic back chucks pad down on the surface. Okay, we want to use that plastic one because that's going to help contain any spills. We're going to need a purple unfit syringe, a pill pouch, okay, and then of course your medication and some sterile water. You'll also need, since it is a hazardous medication, either an isolation gown or a chemotherapy gown, okay? So our isolation gowns would be used for our table 2 and 3 meds. The chemo gowns would be used if we're going to be crushing a chemo medication, an oral chemo tablet, okay? So I'm going to put my isolation gown on before I start crushing or even touching the pill. And then I'm going to use 2 pairs of our regular exam gloves while I'm crushing. I just want to kind of reiterate, these precautions are to help protect yourself from any exposure to a hazardous medication, right? Okay, so I have my PPE on. And now I'm ready to get started with crushing. So I'm going to take my pill pouch, all right. So with your pill pouch, you have this zip seal end. This zip and seal end, I think is what the manufacturer calls it, okay. I'm gonna take my pill and put it in. Okay. I would of course verify the patient, verify the MAR, scan my medication before I start this process, okay. But you can see the pill in the pouch there. Then I'm going to take my unfit syringe and I'm going to draw up about 5 cc's of sterile water. Okay. All right. Then I'm going to attach the syringe to the unfit nozzle on the pill pouch. Okay. And I want to make sure that that's pretty well connected there. And then I'm not gonna inject the water yet, okay? The water's just gonna stay just like that. Then what I'm gonna do is I'm going to make sure that this zip and seal end is completely sealed. So, with the RX Crush, this is considered the pill roller, and this is the crush plate. So I'm gonna put that zip and seal end under the crush roller, and I'm just gonna roll over it to make sure it's fully sealed. So you don't want to risk having an exposure. Okay, so that's pretty good. That feels pretty well sealed. Now what I'm going to do, I'm going to take the pill pack, all right, with the pill, and I'm going to put it under the crush plate, and I'm going to move the handle up and down to crush it. Right, so you can see that crushed it pretty well right there. Okay, and now to pulverize it, I'm going to use the pill roller. So that's just like this. And I'm just gonna go over it until I feel like that pill is completely pulverized. Okay. That looks pretty good right there. You can see it's pretty well pulverized. And so at this point, I'm going to inject my water. All right. And I'm just going to start mixing it. We want to make sure that gets pretty mixed up so that that pill is dissolved. Okay. All right, so once we feel like that pill is fully dissolved, then with the pill pouch up and the syringe below it, we want to just withdraw that medication. Okay. So now all the medication is in the syringe. I'm going to take the pill pouch off, and now my medication is ready for administration into a feeding tube or a PICC tube. All right. Just so you guys know too, these ENFit syringes are designed to attach directly to the iris tube, to the lure end. Okay, this is a lure lock. It will fit right onto the end of that iris tube. Okay. If you have any more hazardous meds to crush, then I would administer the med, drop some sterile water, flush that med through, and then drop some more sterile water and follow that process, okay? But with the new pill pouch. The syringe we can reuse, but the pill pouch has to be new each time, okay? And then once I'm done with administering my medications, I'm going to ball up all of my hazardous med supplies that I use for medication crushing and administration, okay, aside from the RX Crush, all the other supplies I use. These supplies will go into the black bin in the medication room, okay? Your PPE, you can take off. And that goes just in the regular trash. And then you would want to perform hand hygiene with soap and water after handling hazardous meds. The cart itself and the RX crusher would then need to be wiped down with a bleach wipe. And that's that.